The ongoing strike by the National Association of Nigerian Nurses and Midwives, which began this Wednesday, is already disrupting healthcare services across public hospitals. The nurses are demanding improved welfare, better working conditions, and full implementation of past agreement with the government. Trust TV's correspondent visited the Federal Medical Center and other public hospitals in Jalingo, the Taraba state capital, and now reports.
Speaking with Trust TV, the Taraba State Chairman of the National Association of Nigerian Nurses and Midwives, NANNM, Merigi Pius Nathaniel, stated that the association has been engaging the government on multiple demands since 2012, but nothing meaningful has been done. He outlined 11 key grievances that triggered the strike, including the non-payment of withheld allowances for doctors and nurses, the failure to recruit skilled nursing staff into public hospitals, and the government's refusal to honor previous agreements.
We operate under the national headquarters. Whatever the directive has been given to us, that's what we follow. And that's why we see us going up and down to make sure that the strike bring a yielding fruit. And by the grace of God, the strike have gone well and it's 100% operated.
The State Secretary of the Association, Nas Clifford Mafindi, warned that the ongoing neglect could lead to a mass exodus of nurses from Nigeria to other countries where their services are better appreciated, a development that could further cripple the nation's healthcare system. Also weighing in, the chairman of NANNM at the Federal Medical Center, Jalingo, Bilha Yusuf Salami, revealed that the government was given ample time to respond, including a recent meeting with the Federal Executive Council. But after yet another failed negotiation, the union was left with no choice but to embark on the current strike.
The call I'm just trying to do for the government is for them to do the needful so that we can be able to achieve organizational goal together so that patients will not suffer the way they are doing right now. Because as we went around for monitoring, we saw all the patients, there is no nurses on ground due to that strike action.
We have about 11 demands that were submitted to the federal government. Some since 2012, which have not been attended to. And now that we are expecting our welfare with the hardship that is going on in the country, what they submitted to us is not something to write home about. It's not something to be taken home.
Meanwhile, patients and healthcare users have begun to feel the impact. Some affected individuals criticize the government for prioritizing non-essential projects while neglecting the health sector, which they described as the backbone of national development. They warned that delays in medical attention during the strike could lead to a spike in mortality rates across public hospitals.
Though I came here, I have a health challenge too. But when I came here, I discovered that there is no doctors. Since in the morning I was here, we went, they said there's no doctor, and even the little that are here, the 3 of them that are here, they said they are tired. They even said I should come down on Friday. I even looked at my health and I said that means they want me to die before the day.
Just this morning, my brother called me. He said her wife has put to bed. So when I came over to say hi to him and to greet him, the wife is doing fine and the baby is doing fine. So when I came in and I saw other women they are pushing them out of the ward, that the nurses have gone on strike.
It is the nurses that does the work. The doctors are just there to just administer food and that. But the main people that does the work is the nurses. So if the nurses are not there, definitely there will be a lot of death and casualty because doctors are not able to attend to patients.
My mom was her situation is very, very critical. And I don't know what happened. And recently I heard that Mr. President has awarded over 150 million to footballers. And here we are in the hospital. The doctors are on strike.
Both the association and the public are now urging relevant authorities to engage in sincere negotiations with NANNM and bring a swift end to the strike.